Hi, now our next speaker is an incredible woman. She's had an incredible journey. She's actually forayed where nobody has gone before. She has developed almost single.
I want to give a special shout out to anybody from Thai, Boston, who might be listening in, since that was my home ground where I learned about Thai, and I blame it squarely for infecting me with this bug of entrepreneurship. So I was a normal scientist for the longest period of my life. I did my MSc, PhD, then I joined postdoc at Dana-Farber, Harvard Medical School in Boston. I joined a very good company, Vertex Pharmaceuticals in Cambridge, Boston. And then I was inducted into Thai by somebody I know, Gautam Prakash, who mentioned that there is a very strong life sciences group in Thai, Boston. And irrespective of whether I was an entrepreneur or not, there would be a lot of interesting networking and learnings about industry. So I joined probably in 2003-ish. Then went on to become a Thai charter member and mingled with a lot of people who seemed to do it and seemed to enjoy taking on the risk of starting a company. In the same time, when I was at Vertex, I was working with drugs or drug candidates, and we were going to take them forward in cancer, but we didn't know which cancer type to take it forward, among many molecules, which molecule to take forward, etc. And I started working with patient samples, cancer patient samples, in which we would test these drug candidates. And from that, decide that this one is working best in colon cancer, this one is working better in pancreatic, and guess what? This one is not really working that well. So it became a way to stratify the drugs and the clinical trials, which everybody knows in life sciences is incredibly time and money consuming. So you get to do a lot of your decision making in simpler systems without costing so much time and money. Being an Indian, I used to come to India every year during holidays. And so I started thinking, how is it that we do this work always with American or European companies, and there's nobody in India who is collecting these samples, who is processing them, using them for this kind of industrial innovation. So I started meeting some hospitals, doctors, friends who were in these places and asking them, what do you do with the tissues? And routinely, I would go to these labs and see that they would take whatever was needed for diagnosis and discard the remaining. Literally from the table, they would dump it into the waste bin. So I started asking, isn't there a concept of a biobank in India? And I learned that there are a few academic biobanks, and typically they are hospital-based, like All India Institute or Tata Memorial. They will have small biobanks, but they are usually devoted to academic endeavors. They usually do not work with industry, and certainly they are not diverse. They are not going out to service a requirement for developing new diagnostics, new drugs. And we all know India has a lot of patients. So this is one of the opportunities I felt which could be brought to bear on a problem and something new for India, where one would enable R&D of the highest order in India using something that is medical waste today. And so I talked informally to some of my Thai Boston charter members and colleagues, and they all said, yes, it's a good idea. Why don't you put a business plan around it? I was not a finance person, as I said, nerdy scientist. So I happened to meet ex-Vertexian, Mr. Srivatsa Natarajan, who had already moved to Hyderabad and was working at Origin at that time. And we discussed, whether there was common interest, and there was. And slowly that idea took shape. I started working on nights and weekends when I was still in Boston, and we put together a plan. And we pitched it to many hospitals because we needed patient samples. At the base of biobank is a patient samples. And for those who don't know what a biobank is, I should take a minute to say, a biobank is simply a very well organized, cataloged library of human patient samples and data. And that doesn't exist in India in any large scale. So To cut a long story short, in 2010, we did get interest from Apollo Hospitals. In 2011, we signed a non-binding agreement with them. I chose to come back to India after being outside for 26 years. I don't know, it was a huge leap of faith. Nothing was done at that time. It was a non-binding agreement. It took a full year to get that agreement into place. And then in December 2012, 8 years today, almost today, we started Sapien. And Sapien is the first and only commercial biobank in India. We struggled a lot whether to make it a non-profit or a for-profit organization. And coming from industry, and it would resonate with you all in Thai, we decided we would make it for-profit. Because if you are doing something useful, you should have a market out there and you should be able to get validated by people who are willing to put money down. And this is a huge market. This is more than a 20 billion market in the world. And India is not a player in it until very recently. So I moved to India lock, stock and barrel in 2011 at risk, and everything was new. So I was going from a very happily job-oriented person to becoming a first-time entrepreneur. Nobody in my family had ever done that. I was coming to a new city, Hyderabad. I had never lived in India, in Hyderabad, so everything was new. And I was starting a company which I knew very little from the establishment point of view. I know the buyer side. I come from the pharma side. I know who wants to have these samples, but I did not know what starting a biobank would be like. So everything was new. I think we were terribly naive and optimistic. I think an entrepreneur is always hopelessly optimistic, as many of you will know. We did everything wrong. I'm sure Ekta knows how many wrong things we've done in this process, and we are still trying to fix many of them. And over the last 8 years, I would say the first 2 years were very much establishing the very, very basic framework in India because we were the first. So what are the ethical norms? What are the regulatory issues? How to convince people who want to have the comfort of knowing they are not doing something wrong. You know, India is a risk-averse society in general. So first 2 years were mostly a write-off. But in the last 5-ish years, we are now a large chain of hospitals that are part of our biobank. We are in 8 cities, about 23 hospitals. We have more than 2 lakh patients worth of samples. And very importantly, the data associated with the samples. And this data is slowly becoming the bigger mine. So if the samples are a gold mine, the data would be a platinum mine. And very soon I expect to pivot from being a sample biobank to being a knowledge biobank. As all of you are entrepreneurs and many of you are sitting in different geographies, you might be thinking of coming to India. So I thought I would share 3 of my observations in this transition. As I mentioned, I've lived in US for 22 years. And I love that country equally as much as India almost. So I consider myself bicontinental. And so I've had the privilege of observing both US and India. And for those of you who again have one foot in each continent and your heart in one and brain in the other, I'd like to mention my observations. One, India is a very personal society, not a professional society. So for me as a transplant from US, it took much longer to establish myself because people want to know who you are, whose student you were, which university did you go to. And all of those connections for me were not there. I did my PhD abroad, I did my postdoc abroad. So in India, normally you have to gain trust and you lose time in that, but you gain friends in that. So there are pros and cons of that. But first and foremost, know that you don't get results quickly. Many people are very polite on the surface. Your first meeting would go very well, you think, as an American, while inside, later on that there was no interest from that side, but they never told you that on the face. So politeness trumps truth in India, and personal relations trump professional relations. Know that. Secondly, there's a huge gap between academia and industry. So I came from Boston, where many of you will know there is a very, very close networking between academia and industry. And in India, academia is still very much a purist mind frame. There is hardly any accountability in academia. They don't trust industry. So over and over, we would meet people who had prototypes or who may have a diagnostic marker. On the surface, again, it would seem that they want to work with industry to validate it and to bring it into the market, but ultimately they don't trust industry. So they will not share that information. Their currency is grants and publications, not products. So industry really is still very much outside this, and even the government policies and grants are not biased towards industry and products. They are more towards funding a little bit of something like an entrepreneur. But in life sciences, the kind of core facilities you need, the kind of sustained big funding you need is not available from the government. So don't bank upon that. The last thing that is very obvious here is there is a misplaced emphasis on innovation. There's a lot of liberal use of the word innovation, and very little on what I feel is very much needed in the life sciences sector in India. We don't manufacture the basic plastic labware that is needed by every single lab in India. We import it. We don't make the basic cell culture and molecular biology reagents by and large in India. We've tried many Indian sources, most of them don't have consistent quality. We don't make equipment in India that you can rely on. Most academic labs, CSIR, DBT labs you'll walk in will always have foreign brands. So there should be in government's mind, and maybe I'm saying it deliberately because TIE is a very, very good forum in which these kinds of things can be mentioned. There should be a lot of emphasis placed on becoming self-reliant in what is a process issue, a quality issue, not an innovation issue. Why don't we have a thermo-like company, in vitro-gen-like company, many of these companies that make equipment, reagents, antibodies. So I think there is a lot to be done for Atmanirbhar life sciences. And I would urge the government in any forum, if they are listening, please invite industry to give suggestions. Don't just force rules from the top. We are happy to work. We are happy to share our angst and our experience of all that has not gone well to make Hyderabad, to make India what it really can be. There is nothing lacking except good coordination, good, consistent, stable policies to make Hyderabad beyond Boston.
Thank you so much, Jugnu. It was really nice to hear you talk about one is about regulations and how India should get its act together. About more importantly, about validation of your idea through a marketplace, especially when you are
Yes.
looking at figuring out whether to go not profit or for profit. Making it through a very risk averse markets through perseverance, and also leveraging what you had in terms of your samples, and now you're taking that and trying to become not just a sample biobank, but also a knowledge biobank, and leveraging on data that you get through your samples and through your research. It was lovely hearing you speak. Thank you so much. And we can now move on to our next speaker. Our next speaker is actually Mr. Rao Tummalapalli, who is the MD and founder of Seneca Global. So apart from building an organization like Seneca, I should mention that he actually built an organization that ranked ninth in India among mid-sized organizations listed by a Great Place to Work. Apart from being active and making companies and growing to scale, he's also a volunteer with Dakshina Foundation, which is working towards alleviating poverty in India. So Rao, over to you. Love to hear your journey and your experiences. Um,
Hi. Hi, everybody. This is Tummalapalli. I'm an entrepreneur for the last 26 years. I was living in the US. I came back to India in the late 90s and 98 to create jobs in India. That was the sole intention. My goal at that point was to create 100 high-paying jobs and lasting jobs, and also build an organization that lasts along the way. So we set up, that was arguably the first outsourced, or certainly one of the first outsourced product development companies out of India. We felt that the technology can be leveraged more than the immigration to give the best value or the most value to all the stakeholders. So I teamed up with an American gentleman and set up a company that hired only local talent in US and India and used the communication and occasional travel to deliver the most value. Then I exited the business and then I started Seneca Global, about 12 years ago. The common theme is the product development in high-end technologies. And again, as I said, the goal is to add the most value. Till date, we built over 100 products, primarily for the US market. We built some products for European and Australian and Indian market as well, but primarily I would say North American market. And I work a lot with entrepreneurs. We have the track record of building products from ideation to exit, products and businesses. Seneca Global is a product services company. Primarily, we also invest in companies. We work with entrepreneurs. One of my goals, apart from building organizations and creating jobs, was to create more leaders, create more CEOs and MDs out of India through our businesses. Directly, where some of our folks went on to run businesses, and indirectly, where we work with entrepreneurs and fund their ideas and businesses. We provide more than technology. We provide capital, we provide technology, we provide business experience. We have a small team of highly senior folks in US and India that partner with us, partnered with me to do this. And one of our most recent investments is, you heard about cognitive robotics few minutes ago from my colleague Meenakshi. I'll spend actually a couple of minutes talking about it from a technology standpoint, perhaps. Hope you can see the screen. Basically, the goal is to reduce the cost of intervention for people with autism. This subject is new to me. I'm a technologist, actually. I'm still getting educated, but I'm very much involved in this business. Even though we have close to 10 investments today, this is one business. I'm deeply involved. I'm on the board of the business, and I'm spending a lot of my time on the business, actually. It still is educational. I'm still learning about this problem. But what struck me was that here is an opportunity for Seneca Global and me to make a huge impact. I'll spend a couple of minutes explaining why we got involved with cognitive robotics. It is a business at the end. Cognitive robotics has an extraordinary, business opportunity, but equally or more importantly, my partners and I saw an extraordinary opportunity to make an impact. And the kind of impact I couldn't make in the last 22 years working in India. We created over 2,000 jobs through our businesses in India, but I think cognitive robotics can make even a bigger impact. It's a technology play, but the problem is complex. Technology is just an enabler, especially today with all the computing power. It is strange that some of the technologies, I did my master's in AI lab, 30 plus years ago. All the things we used to talk about then, they're a reality now, thanks to the computing power and some of the new paradigms. So here is an opportunity for us, and we got involved. And the problem we are trying to solve is complex when you look beyond technology, whether it is a user interface, product efficacy. We have a great team of specialists and parents who are working with us to solve the problem. The minimum viable product is ready. We're in the process of raising some capital. And I'll see if I can play a small video, actually. Let me see. Nope. One second.
So you'll have to stop sharing and share again to show the video.
Yeah, that's what I'm trying to figure out. I'm a Teams guy. So let me see. I can't. I think I'm having some trouble. Okay, good. All right, I think I'm almost there.
So from planning.
So are you presenting anything?
Yes, there should be a small video that should be playing. There's a technical glitch.
Yes, you can play that, no problem.
Yeah, hopefully that will work. Can you see the video and listen to the video?
While sharing, sir, can you put share? Can you stop sharing? You get an option of share the computer sound. Yes, we can hear.
Children being diagnosed with autism.
I guess there's a technical problem. Forget the video. It's coming back to cognitive robotics. Basically, we have the minimum viable product ready, and we're in the process of raising capital, and we will bring the product to the market in the next 9 months or 10 months. And as I mentioned, this is a significant opportunity for me personally and Seneca Global to make a bigger impact than what we have done through the multiple businesses we have built and all the jobs we have created. Thank you.